Hey everybody, it's Jessica DeMassa with What's the Future Health. We are talking to the who's who of health tech and healthcare innovation. And joining us today, we have the CEO of Ginger, the digital mental health darling, Russ Glass. Welcome. Thanks for joining us today. We have 100 million reasons to talk to you, I understand. So congratulations on that Series E raise, Blackstone led. What can you tell us about this money?
Well, thank you. We're hugely excited. This is the first time I've been called a darling, so I also appreciate that. We're thrilled. Blackstone is an incredible firm, global reach, and they've got 500,000 lives in their own portfolio of companies. They believe that mental health is one of the most critical issues of our time. And in researching the space, they found Ginger to be the one that they wanted to make a bet on. So we're honored and thrilled to have them on the team.
That's awesome. Very exciting for you guys. And I think, not a moment too soon. It seems like the amount of funding that has been put into digital mental health in particular has just been staggering this year. I mean, and we're looking at, multiple companies that have over $1 billion valuations. I mean, Lyra Health, they 475 million they've raised total, and there are others who have raised 200 million. You guys are in that tier. We have Talkspace that's going public via a SPAC IPO. I mean, this is such a well-funded space. Who wins? Like, how does this all sort itself out? Or is the need so great at this point that there's plenty of market share out there for everybody?
Well, first of all, I do think it's a little bit misleading to think that this space is overfunded. And the reason is it's been so poorly funded in the past. I look at this more as the industry catching up to the need and realizing just how big a problem this is and just how big the supply-demand imbalance is. And as those investors see the need that's coming, the digitization of health in general, but then the importance of mental health to the overall health of our society, they're recognizing that this is a place that it makes sense to invest and put money to solve these problems.
You and I have talked a lot about that supply and demand imbalance. And I want to ask you this, especially given, and I love what you said about how it's like the market is finally getting the funding that it deserves. But is there how do you make sure that the supply side is shored up in addition to the capital? I mean, there's a limited number of practitioners out there. Technology can only go so far. What are you guys doing at Ginger to make sure that your supply side can scale to match the demand that is out there?
Well, I would say that when you look at how Ginger is approaching this space, it's focus on supply side innovation that guides us, that helps us prioritize where we're innovating and helps us prioritize the things we think about. Because ultimately, when you've got a supply demand imbalance with literally unlimited demand, it's supply side innovation that you need to think about. And I think our differentiation in the long term is going to be all about how do we reduce the cost of high quality care in a scalable way. That's it. It's a very simple mission we're on. Reduction of costs, high quality, at scale. And I think if we can continue to do things like, automate different parts of the ecosystem, personalize care so that it's more relevant to people, minimize the amount of care delivered for those who don't need more, but maximize preventative care and maximize early care for those who do need it. All of that goes into ultimately solving this problem and frankly teaching the world how to solve the problem so that others can mimic what Ginger's doing. Others can follow, because it's not going to be just us that solves it. It's going to take a lot of companies to solve this problem.
I want to talk a little bit about the value-based care model that you guys have launched. I understand this was something that came out new last year. And you and I spoke a couple times last year, once in April at the very beginning of the pandemic. And then we talked again in September after you closed your last round of funding. But this kind of, I think, was in flight. So I want to hear about this this approach. I want to hear about this model. I guess great uptake with the employers that you guys work with. My understanding, you got 500 employer clients. I don't know. There's like a nice percentage of them that have opted to go this value-based care model route. So explain this to me. How is this different than what you were doing? And why do you think it's so popular with your client base right now?
Great question. Well, last year we realized that nobody was really thinking about mental health in a value-based way. So, and simply, employers paying for the value that they're getting out of what Ginger's delivering. And so we decided, let's take all of our services and effectively bundle it into a single price point and attach the things that we're going to deliver for that price point. And that's clinical care, it's coaching level care, it's content, it's self-care, all into a single price.
Okay.
And what has happened was astonishing to us. We figured maybe we'd have like 10, 20% uptake and we'd build from that over time. And it turned out that 60% of our customers that we signed last year chose the value-based model.
Whoa.
Huge, right? So it proved to us, one, that value-based mental health care is here to stay. It's in super high demand. It's something that employers are really interested in. And we think it's a baseline for where we want to take this over time and continue to grow services that deliver high quality care at great price points, predictable price points, to make sure that you're giving your employees the access and quality mental health care they need.
Can we dive in on that price point thing for a second? I'm really curious about that. So it's one price per employee for like the whole year, or how does that work?
It's a pure employee per month. That's right.
Per employee per month. Okay, so PM. And then, so like the thing, like the next question I have to ask you, because it's like the value-based care questions, like this puts you guys at risk a little bit more, right? Because it's like, you've got to make sure that the level of care that you provide to these folks is appropriate, more or less, right? In your words, reducing the cost of care, right?
Yeah, that's exactly right. So we're basically saying, look, we are going to take responsibility for this type of care for this population. And, fortunately, we have enough proof points at this point to be pretty predictive in terms of personalizing care, in terms of what kind of care is it going to take to get somebody healthy, and making sure that we can monitor that over time so that they're getting what they need from us.
Say more about the proof points here, because I'm curious about what you may have learned last year. I mean, in terms of like just the volume of utilization, the number of new people who access the platform. I know you guys have have some survey results from your workforce attitude survey that talk about utilization and people who are using whether it's Ginger or not, a digital mental health platform to help with their own either anxiety, depression, or other mental health issues. But I'm curious to know what you've learned and how your business has, taken, more of a different shape as a result of like learning from it, having this much volume of activity on your platform.
Well, first, let's start with looking at a global pandemic and thinking you can predict off of that is probably folly, right? So right. What happened last year was astonishing. We had 265% growth in our coaching volumes. We had 370% growth in our clinical volumes. So not only did we have these huge increases in need, but it was more acute. People were more serious. We saw this in the surveying. We did the workforce attitudes report, which we saw some incredible discrepancies between what employees thought their companies were doing and what the CEOs of those companies thought was happening. So just a lot of change last year. The upside to all of that is people are adopting digital health solutions and digital mental health solutions at a far faster rate than we expected. So that's positive because that's here to stay. The downside is people are suffering in a way, in a volume, in a scale, unlike anything we've seen in recent history. And so it just means that we need more solutions like Ginger out there, right? To help support all of these people that need support.
All right, tell me about the business a little bit. I understand as far as like, a big dollar raise like this usually means, big scaling plans are going to be enacted, and whether or not those scaling plans end up leading to another kind of fundraising event or not, or whatever, we'll leave that up to speculation. But can you tell me what's going on as far as growth plans for Ginger over the next year? Like, where are you guys looking at? One of the things that struck me in the press release I read about the funding round was that you guys are looking to work with government payers and establishing a relationship there to help bring care to underserved populations. Can you say anything about that?
Yeah, so there's a lot in there. I mean, first of all, we grew 3x this past year on top of, 3x growth the year prior. So we continue to grow at an incredibly fast rate. What's interesting about the business is we're getting pretty good at the enterprise side of the world. We really kind of understand the employer business. We know how to find those employers that need help, that want a solution like Ginger. We know how to close them and launch them and scale them. And this year, we're launching our first really scaled health plans. And we don't have the same level of understanding in the health plan world as we do in the enterprise world. And so this year is really all about that next stage towards our mission, right? Which is, it's not just employees. We're going to continue to support them because we think they have a huge need and they're highly valuable, and we know how to do it. But we've got to get into populations that may not have good jobs or may be, less able to afford the kind of solutions that an enterprise can afford. And so that's what we're really focused on in expanding to our health plan business this year. We're super excited about it.
All right, I'd love to hear what's on the docket there, if you can get into any of the details. Any new tech that you're going to be looking to integrate? I mean, you're well capitalized now, so you're building, acquiring. What's on the roadmap? Can you tell us?
We are going to be very innovative, both in what we're building. So we continue to innovate on solutions that automate parts of the process, personalized care. We are also very aggressively looking at M&A and growing based on other companies and what they're doing in the space. So, we hope to announce something in the relatively near future, and we'll continue to look at companies that are doing interesting things. There's actually one of the interesting things about the space is there's so many companies doing interesting things, but they're subscale.
Yeah.
And so being able to take Ginger's scale and bring some of those technologies in, we can bring those solutions to people faster. And that's another big part of this, is how do you use what we've built to make sure people are getting support as fast as possible.
I'm curious about, to get your thoughts on, you're talking about scale and bringing care to populations, wherever they're at, whether or not they have an employer who's sponsoring it or not. I'm curious to know what your thoughts are on some of these direct-to-consumer companies that are creeping into mental health. So it's like we just saw Roe raise $500 million. They've got anxiety and depression as some of the things that they treat. Hims went public via SPAC. It's like, that's another thing. I talked to the CEO there, and that was something that's on their list, was expanding their mental health services. So how do you see that impacting the space that you're in? Where it's more of a traditional approach to providing strictly, digital, like mental health. And now you're seeing these primary care companies, whether it's, the Rose and Hims of the world, or even some of the boutique primary care clinics like the Crossovers or Oak Streets or whoever, One Medical is coming into this space as well. I mean, how do you see that primary care influence changing the way that mental health care is delivered in the market?
Well, look, I mean, in as much as any company is out there trying to figure out how to deliver high quality mental health care that's integrated with the healthcare system, I think it's awesome, right? We need as much of that as we can get. I worry a little bit about some of these models that are sort of quote unquote pill factory models, right? So I don't love models where the incentive is prescription medication, because if we've learned anything in the mental health world, it's that we are over prescribing prescription medications by a huge amount, right? Most people, not everybody, but most people don't need to be taking these prescriptions. And yet we've got a huge percentage of our country that are on them. So I worry a little bit about that. Ginger actually recently created a partnership with Capsule to help with medication management and help people get access to their medications in a more timely fashion, help them get a real psychiatrist that really understands titration of these drugs to help them with that. But we make zero profit on those drugs. So our incentives are actually to get people off of those drugs and get them into more sustainable, longer term ability to manage their mental health without having the side effects of being on these medications or costs of being on these medications.
So, I mean, as far as those types of companies are concerned, do you think they're helping or are they hurting as far as mental health care delivery? Does it change the conversation in a way that's not helpful at this point?
Look, again, without being on the inside of those companies
Yeah.
and knowing exactly where their incentives are, I'd say if they're delivering high quality care and they're doing it in a way that is more scalable and integrated with the healthcare system, I think it's great.
Okay.
If they're schlepping, and hawking pills, it's not great.
Right. Well, fair enough. Fair enough. So, all right, last thing for you. I just want to talk a little bit about your own model, because one of the things that I think has always been unique about it is the fact that you've got different levels of practitioners providing different types of care kind of all along the spectrum. How does that grow now with you as you guys are scaling up? I mean, give us a sense of like to make sure that people are getting the right kind of care they need, or, to make sure that they're not on medication that they don't need to be on. I mean, explain a little bit more about how your clinicians work to deliver the kind of quality care that you're talking about, especially in that value-based model.
Well, when Ginger looked at the supply-demand imbalance problem, we realized that we had to rethink the entire spectrum of care. We had to rethink how this was delivered so that it was going to be more scalable. And so the first thing that when you show up at a Ginger, the first thing you experience is the ability to connect with one of our behavioral health coaches in a chat-based experience. And that does a few things. First of all, it's available 24/7. So no matter when you have a need, what that need might be, one of our behavioral health coaches is there to support you. Two is those coaches reduce the friction of starting in your mental health journey. It's easier just to chat with somebody for a few minutes and just kind of make a connection. But then those coaches can be longitudinal. And it turns out the vast majority of our members stay in coaching care. They come in, the coach works with them. I liken it to a gym coach where a gym coach is teaching you what exercises you need to do, how to do them properly, but maybe most importantly, they're holding you accountable to show up. Our behavioral health coaches are very similar for mental health. They're helping you understand what your needs are, give you exercises, give you self-care routines, but then setting goals and holding you accountable for accomplishing these things. 20% of the time or so, people need more care. And that's where our collaborative care model starts, where we bring therapists in, we bring psychiatrists in if medication management's needed. And now it's a team that is working with you because we want you to graduate as soon as possible from that higher level of care and go back to the coaching level. That whole system has scale written all over it, right? The whole design of getting people into the system, getting them to exactly the right care, stepping them down as soon as possible, but giving them longitudinal support so they don't have recidivism, all of that's designed to scale. And then, of course, a whole bunch of technology powers that.
Oh, yeah, of course. Of course. I love that, though. But I think what people forget about this is just like, you say that and it sounds like, oh yeah, of course it would work that way. But like up until recently, of course it did not work that way. And in a lot of cases, for a lot of people, it doesn't. So Russ, I mean, we're headed into like the middle of the year here, 21. And it's like, I'm sure I'll be talking to you again very soon. But, it's like, how do we look as far as like the mental health of us? I mean, I know you have your workforce attitude survey. Just leave us with like maybe something, something that we can hold on to in terms of a positive outcome of this pandemic, when it comes to our mental health, even though I know so many people are out there and they are suffering and there is a lot going on still. I mean, is there anything that we can look to in terms of a bright side?
Oh, yeah. I mean, first bright side is that, vaccines are here. And I think hopefully you're going to have a much healthier population. And this pandemic from a physical health standpoint is going to be largely behind us in the not too distant future. I do think the second positive is that it's brought out ability to talk about mental health in a way that's never happened before, right? There are people There are people now who are willing to say, I need help.
Yeah.
So it's destigmatized mental health. Employers have actually started to invest in these solutions at a far greater rate than they ever had before. So that's a positive coming out of this. And I'd say the final positive coming out of it is that the adoption rate of digital health solutions, so the people's willingness to do things in a digital way helps us scale. So the fact that that's accelerated as much as it has during this period is going to help mental health solutions scale to solve people's problems. So all of that's positive. On the concerning side, there's going to be a long tail of mental health issues due to the pandemic. It's not going to just go away when we're all out and about again. It's going to take time, and people just have to recognize that and get the help they need in order to get through this.
All right, Russ, thank you so much for letting us pick your brain. As somebody who's covered the digital mental health space before the pandemic, through the pandemic, and now on our way out of the pandemic, it's been so interesting to watch this space grow and to really see. I mean, I love what you said at the beginning, this funding kind of start to match the real need that's always been there, that just became, something that people really felt more comfortable to talk about during this pandemic. It made it okay, destigmatized. So congratulations to you on the new round of funding. We want you to go scale up, fix the supply and demand imbalance, and then come back and talk to us when you do.
Sounds good. And I always appreciate you having me. Thanks so much for continuing to cover this like you have. And we'll look forward to talking again.
My pleasure. I'm very passionate about this space, and I'm excited to see all of the companies that are, trying to tackle this from all of the different areas that they're trying to tackle it from. And so, yeah, keep doing the great work that you guys are doing, all of you out there. And for more interviews with folks like Russ who are working on this digital mental health space, you can check out my YouTube channel over at youtube.com/WTF Health. I'm Jessica DeMassa. Again, this is Russ Glass, the CEO of Ginger. He's just closed a $100 million Series E round. Congratulations to him, out to solve the supply and demand imbalance in digital mental health care. All right, we'll talk to you guys soon. Thank you so much for joining us. Bye.